Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India. I would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, I have the very excellent team of doctors. You can definitely contact us for paid online consultation on the mobile number 922681060. Plus, please, I request, don't phone, please only WhatsApp. We will guide you how to do the payments and all these things. My dear friends, I have started the series like the TV serial Ayurveda in GP, that is Ayurveda in general medical practice, and today's topic is fainting or the syncope. In Ayurveda, it is also called as a murcha. Now, in everywhere, we are talking about the causes, modern causes, according to the modern perspective. Then we will talk about investigations and most important, Ayurvedic prescriptions, Ayurvedic medicines that we are discussing. But before that, let me clear you that murcha is a basically problem of vata dosha or pitta dosha. Try to understand vata or the pitta dosha. The vata dosha is disturbed because of the dhatu kshayajanya vata prakop. If there is a debility, weakness because of the deficiency of any dhatu, we have the rasa, rakta, mans, med, asthi, majja, shukra. For example, if the person is having dehydrated, then he can get the murcha, that is rasa dhatu problematic, and vata dosha and rasa dhatu. Another person is having low hemoglobin. Normal is 12 to 14 gram percent, but he is having a 10 gram, 8 gram, 9 gram percent, then vata dosha and rakta dhatu will be the problem. If any person is having the weight loss because of the tuberculosis, because of the cancer, because of the HIV, then he may have also the fainting. So vata dosha and mausa dhatu. So similarly, we can make a sequence. Even bone weakness, calcium deficiency, vitamin D deficiency, this can make the vata prakop. Try to understand. Another reason is a pitta prakopa. That means if there is excessive heat in the body, then also there may be the fainting attacks. For example, if the person is keeping late at night and going to the bed, say at midnight, then there will be vata prakop, also pitta prakop, and on the next day, he will get the fainting problem. If he is eating too much spicy, then also can create the pitta prakop, and this type of the little bit fainting attacks can occur. So try to understand, we have to take care of not to get the vata prakop and the pitta prakop. Vata prakop is because of the irregular lifestyle and hectic lifestyle that becomes the vata prakop, not taking proper beverages like the water and fruit juices and all these things. Pitta dosha prakop can be prevented by proper taking the soft and sweet type of the food, not eating too much spicy, and also not going for any vices like the alcohol, smoking, and all these things that can make the pitta prakop. You have to control your brain also, because if it is a too hot tempered, do you understand? If the person is having the too much jealousy, too much ambitious, that can make the pitta prakop and can cause the fainting attack. Now let us talk to discuss about the modern causes. Syncope due to the decrease of cerebral perfusion pressure, less blood supply to the brain. It may be the vasodepressor syncope is a very common problem like the faint in susceptible individuals, very delicate people, emotional and physical stimuli. If there is a shock at any time, anywhere, any sort, then that can create a emotional shock, can also create the fainting attack. Physical stimuli, too much pain, too much fright, unpleasant sight, exhaustion, very hot atmosphere in the summer. You know, in the summer there is a common heat exhaustion, and heat exhaustion, you get this particular fainting attacks. Then long period of standing in the same position, that can occur in the students when they are performing the laboratory practicals. If there is a police people, they are standing in the hot sun for a longer time, he can get the fainting attack, may produce income, and this is called as a vasovagal attack. In that case, first thing you have to do, take the person in a shade or in a where there is no hot, a proper fanning should be there, crowd should be avoided, and loosen all the clothes. That is the most important. And lying down position. Lying down position will automatically recover from this simple fainting attacks. Okay. Then carotid sinus syndrome, attacks of unconsciousness result from hypersensitivity of carotid here sinus. It occurs most frequently in the elderly, in association with hypertension or arteriosclerosis. Hypertension, you must take care, because any type of the hypertension normally is 120 by 80 mm of Hg. Hg is a mercury. So 120 is a maximum pressure exerted by the blood vessel, that is called as a systolic blood pressure, and 80 is a diastolic blood pressure. So try to take care of your blood pressure. It should be always controlled, and regular medicines are very much essential. Not a single day miss, that can make a havoc. You can get a cerebral bleeding. So hypertension, epilepsy, these type of the medicines should be taken very, very regularly and under the supervision of doctors. Arteriosclerosis is a hardening of the arteries. Postural syncope occurs as a result of failure of baroreceptors, which commonly adjust the heart rate and the peripheral resistance in response to the change of posture. For example, if I am lying down and if I am standing, sitting, or if I am standing, then there is a little fluctuation in the blood pressure, but that is automatically corrected. Try to understand. But for example, in the lying down position, and the patients get up early in the morning, by jumping, they make collapse, or that may be the cause of the fainting attack, especially in the elderly people. That is also because the adjustment of these baroreceptors is not proper. So what we advise to this patient, don't jump from the bed when you are getting up. Just lie down over there, turn on the right side, slowly try to sit down, sit for a few minutes, and then start to walk. This is a simple advice, can avoid the further fainting attacks. Okay. Now causes: getting up abruptly from prolonged period in recumbent position often causes giddiness and syncope, particularly in the presence of cerebral vascular insufficiency. Cerebral means brain, vascular means blood supply, less blood supply. Following the strenuous physical exercise, too much running, athletes and all these things, trekking, that can also cause the fainting attack. Chronic orthostatic hypotension may result in giddiness or syncope or both, following a decline of systolic pressure, usually at least 30 mm of Hg. That means in spite of 120, abruptly it comes down to the 90 mm of Hg. So difference is 30 mm. When the patient remains stationary in the upright position. In association with neurological disorders, like for example, diabetic mellitus can cause the peripheral neuropathy, other forms of polyneuritis. ITS is an inflammation. In patients receiving the typical medicines like phenothiazines, or patient of Parkinson's being treated by L-DOPA, they can get such type of the postural hypotension problem. Next cause is a cerebral syncope. Syncope is a consequence of direct brain damage secondary to the trauma, road accident, or associated with carotid, this is the artery, or vertebrobasilar disease. Okay. Now, next is a cough syncope. A bout of cough and the patient collapse or the faint down may occur after paroxysm of cough, especially in the patients with bronchitis or emphysema, and is caused by increase in intrathoracic pressure, which occurs after coughing and impairs venous return. That means venous return will not be proper, and the patient a little bit get fainting attack, but that is a very temporary phenomena. So proper anti-cough syrup, especially Ayurvedic or modern Talisadi churna chattaned with honey, that can also avoid the dry cough problem, and cough syncope can be definitely avoided. Micturition syncope may occur in the man with lower urinary tract obstruction, like for example, maybe BPH, benign prostatic hypertrophy. Prostate is a gland around your urethra or the penis, straining excessively to pass urine, especially at night. So be careful. If you are the old people in your house, grandfather or the father, then senior citizen, when they are going to the toilet, they should not violate while standing. First, they properly take a position and then they can micturate. Okay, because if at all during the micturation he gets fainting attack, there may be trauma to the head and all these things. Okay. Second stage of the causes, syncope due to the inadequate cardiac output, that is called as a cardiogenic syncope, because the root cause is your heart. First, cardiac diseases causing the central circulatory obstruction, pulmonary stenosis, pulmonary hypertension, angina pectoris. You know this disease that is called as ischemic heart disease. Less blood supply to the heart muscle. When the patient starts climbing or walking or climbing the hill, he gets the pain in the chest that is called as angina pectoris. And so you know the MI is a myocardial infarction, that is heart attack. Then cardiac arrhythmia, lub dub, but lub dub, lub. This is irregular, that is arrhythmia. Attacks of paroxysmal intermittent tachycardia, particularly in the elderly, high grade partial heart block. This can cause fainting attacks. Then there is a reflex syncope, cardiac standstill, okay, occurring from the reflex vigor activity, like following the distension of viscera. These are something very uncommon type of the problems. But we, as a team of the doctors, we definitely make a proper history taking and question and answer, and we try to find out the basic cause, and then we treat the fainting problem. Investigations, you can do the electrocardiogram, graph of the heart to rule out the cardiac cause, fasting and postprandial blood sugar or post-glucose blood sugar to rule out the diabetes. Now treatment, rule out the cause, sanshepataha kriyayogo nidana parivarjanam. Try to correct the basic cause. Then vasovagal attack and cyanosis, first loosen the body wears, sprinkle the cold water or rose water if available, assure the patient and make sure about the fresh air should come. No crowding, no overcrowding is allowed. Then Hemagarbha, Ayurvedic emergency medicine, Hemagarbha Matra is available, and that is Chatana. Rub it on the stone with some, what you can say, the honey or the ghee especially, and give the chatan. That is called as a sublingual administration. Then internally, Suvarna Sutta Shekar, 60 milligram tablet or 60 milligram powder mixing with the Sut Shekar, 2 tablets. Stat we have to give either powder or the tablet. Then there is another tablet, Lakshmi Vilasa Guti, 60 milligram with Morawala every 10 minutes. That will prevent the further attacks. Chandrakalaras Pittagna treatment, anti-pitta, 250 milligram plus Praval Basma Coral, 250 milligram, Thanda Cool, Gulvel Sattva Guduchi, Yellow, that is a Tinospora cordifolia, 500 milligram plus Pearl Moptic Basma, 50 milligram 3 times in a day. Now postural, I have explained to you, the patient is lying and want to sit. Immediately he gets the fainting attack, giddiness. Always be conscious while changing the lying position to recumbent or standing. Slow and steady. Thanda, dheere, dheere karna hai. Cough syncope. If it is a dry cough, Talisadi Churna 1 gram 3 times in a day with honey. Stay away from smoking. Micturition syncope, Chandra Prabhavati 2 tablet Rasayana tonic to urinary tract 3 times in a day and to control the prostate gland. Rule out any mechanical obstruction and try to release it. Regimen, never suppress the natural call for urine or stool. That means if you want to go for urination or the defecation, Ayurveda say these urges should not be obstructed or stopped manually by your own wish. That is not correct. My dear friend, this is all about fainting or syncope attack, causes, investigations, and the treatment. Of course, there I have missed one point. Please note down, to rule out the brain problem, sometimes we have to do the X-ray of the brain or the MRI of the brain or the CT scan of the brain. That may needed in very rarely, but some patients, and that we have to do to rule out any tumor, any growth and bleeding and all these things. Okay, so thank you very much. We will see you in the next video. Till then, take care and have a nice day. Please don't forget to subscribe my YouTube channel for getting such fantastic videos and scientific but in a lucid language. We will see you in the next video. Thank you very much. Take care.